Words from a Republican congressman this morning on the Senate's failure to pass a health care bill. I asked Congressman Luke Messer what he thinks the correct path forward is for health care.
Well, what we learned here in the last couple of weeks is that the Senate is broken. You know, it's not okay to promise for 7 years that we'll repeal Obamacare and replace it with something better, work at it for a few weeks, shrug and walk away. We need to keep that promise. And the number one reason we need to keep that promise, Katie, is because Obamacare has been bad for middle-class families. Let me give you a statistic. 150,000 Hoosiers last year paid taxes and penalties under Obamacare that made less than $50,000 a year. That's working families. And then you combine that with all the families that have seen their premiums spike to as much as $1,000 a month for a policy with a $10,000 deductible. It's unaffordable. And then just in the last few days, we heard the announcement that premiums on the Obamacare exchange in Indiana are going to go up by 20%. It's unacceptable. We can't stick with the status quo. So I believe you'll see the health care debate continue.
Is it fair, though, to only say this is the Senate's problem? Republicans, not just in the Senate, in the House and the Senate, have been promising to repeal and replace this. Are you willing to work across party lines? Are you willing to work with the Senate to try to come up with ideas?
Well, we did pass a plan in the House, and we got it to the Senate. We didn't get it out of the House as fast as I would like to have seen us do it. Maybe if we'd have passed it a few months earlier, this could have passed in the Senate. The bottom line is Obamacare repeal failed in the Senate by 1 vote. There were a couple Republicans that voted against Obamacare repeal, but our Indiana Senator Joe Donnelly voted against Obamacare repeal as well. I'm glad to work with anybody who's going to help us provide more affordable health care to working Hoosiers. But I have to tell you, there's been a lot of talk about that across the aisle, not a lot of action.
When do you think this will get done, realistically?
Well, taxes need to get done before the end of the year. I'm hopeful that health care will happen either yet this year or early next year. And again, I'm hopeful because I talked to thousands of working Hoosiers that are hurting under the existing system.